So welcome friends. I am very happy to welcome Dr. Karthik to the interview session. Actually, Karthik has secured a rank, AML rank of after the phase 2, he has secured a rank of 8 and his CML rank was 24, right? And that obviously tells that he has robbed the part 2, that is phase 2. That is, he had a sudden jump of
Thank you,
rank
sir.
from 24 to 8. And this tells the importance of actually the phase 2 also. And we'll go and discuss about phase 2 much in this interview rather than we are discussing more about the preparation and everything, because phase 2 he has done an awesome job. And he is from Andhra Pradesh basically, and he did his MBBS from Vijayawada, right? And then
Yes,
he
sir.
did PG from Guntur Medical College, and he is right now doing his senior residency in Katuri Medical College, Guntur, Andhra Pradesh, right?
Yes, sir.
So, welcome, Karthik. Really wonderful, awesome job. And I know you were telling me about your journey, like last 1 or 2 years, your journey you were telling me. So,
Yes, sir.
just give an introduction and tell me how was it for you. And you got a good rank in the NEET, but still you were preparing for INI, and your perseverance was something which is really applaudable and really
Thank you,
really
sir.
great. And how was
Thank you
your
so much,
preparation?
sir.
How are you feeling right now?
Actually, I'm feeling very happy, sir. After attending the paper, I thought that I may not qualify for this, sir, because the paper was very tough compared to previous sections, sir.
Yeah,
But
agree.
luckily, somehow I managed to get a rank 24 in the common list and eighth rank. Eighth rank I did not expect, sir, because uh, I thought that I have not done well in the interview, sir, because I can't guess what they were asking, sir. They were asking approaches mostly in the interview. So approaches, I thought that approaches may be different for Central Institute or my institute. So I thought there may be approach may be different. But after seeing the rank, I thought that for any institute, the approach will be common, and approach is very important in neurology. Uh,
Yeah, actually, in fact,
actually,
the part one also, phase one also, if you see the question paper, there are a few questions which are totally out of the box. You need to buy hard things, but majority of the questions were somewhat practically based. Everything is basically, if you have the concept, you will be able to arrive at least one or two options at the end, and you have to decide between
yes,
the
sir.
two. Like, and so,
Yes,
and
sir.
even the phase two, actually, I was telling during the, I don't know whether you were there in our preparation session. Actually, I was telling that you cannot prepare specifically for stage two. Stage two,
Yes,
what
sir.
they, as a neurologist, when they're sitting in front of you, they want to assess is, do you have the aptitude towards a subject, and how you're going to approach, and what you are going to sit in a national institute in the casualty or the OPD, you're going to see the patients in national institute. Will you have the aptitude rather than knowing stuff and clearing an MCQ? That will be the thing. Fundamentally, they want to know. That was I was expecting, and you cannot prepare for a phase two, which is an video based online phase
Yes,
two. You
sir.
cannot prepare specifically. If you have the stuff in you, you can perform well. And
Yes, sir.
which year you have passed out your MD, and how did you prepare
Uh,
for the phase one as well as for the NEET? How you prepare for that?
actually, I finished my post graduation in 2021, sir, during the COVID first wave. After
Yes, sir.
completing my senior post graduation, I joined in a private medical college, Katuri Medical College, in my same place where I did my post graduation. I attended my first INSS in December, sir, December 2021. In that session, I did not qualify, sir. I got only 36 marks in that session, so I did not qualify. 1 month later, I attempted NEET exam, sir. For that NEET, actually, I thought my own preparation will be enough for that NEET. Why to take any help, like any app? No need. I will. My knowledge is sufficient. I thought in that way, and I got rank 188, sir. Actually, I was very dissatisfied with that rank, sir, because to get a rank in my hometown, to get a seat in my hometown, I should be getting a rank of around 100, sir. 50. So that time I thought, okay, taking a help is very important. And immediately after the result in February, I took Marrow apps, sir. Since the February, I started preparing for Marrow, sir. Initially, I prepared general topics, sir. Later, I came to know that next INA session will be there in April. So I'll be getting 2 months of time for preparing for INA. So let's give a shot. So I completed my all your Marrow neurology videos by in 1 month, sir. Daily, I used to listen for 6 to 8 hours daily, or 3 to 5 videos I used to listen daily, and I used to make a notes. And for that previous INA session, that April session, I only read your notes, sir. I only read the notes. I revised the notes in 10 days and I went to that exam, sir. In that exam, luckily, I managed to get a rank 25 in that, common rank 25 in that exam and 28 in the AML, sir, AML list. So at that time, I got a confidence as, okay, Central Institute is also my cup of tea. Initially, I used to think that, okay, I can join in only local institutes and central institutes are not my cup of tea. So I thought, okay, only toppers will be preparing for INA or anyone with only AIIMS background or Central Institute background can easily prepare. But after getting a rank in that and with only Marrow preparation, getting that rank actually boosted up my, sir, and I started preparing for after that, sir. But as a shocking news, we came to know that the NEET will be of a different pattern this year, not neurology. Uh, so for the 2 months, I actually struggled for completing medicine part, sir. Actually, I did not perform well in the recent NEET exam, sir. I actually got a rank of 801, sir, 801. So again, the same story, sir. Same. For getting a seat in my hometown, I actually should be getting less than 500 rank. Again, I was devastated. Okay, maybe I should drop the super specialty preparation, and I plan to continue as a medicine consultant physician in private medical college or any hospital. Later, I came to again note that INSS will be there in November, sir. So again, I started preparing since September 2nd. I attempted NEET exam, sir. After 2 days, I came to know that okay, I'll not be getting paper was somewhat easy, somewhat tough, sir. I could not guess tell that pattern also. It was more of pediatrics, so I thought, okay, I'll not be getting any seat, and I started preparing from September 5th, sir. September 2nd, I attempted the exam, and I came to know that okay, this exam will be smashed. I will not get any seat in this exam. Okay, let's start preparing for next November INA. So I started preparing for from September 5th, sir. So the major point was that I was having a Marrow notes with me, sir, at that point. So actually, that boosted up my motivation. That gave me motivation, sir. Okay, with Marrow notes, I completed this, and so let's read another time. Marrow, let's revise Marrow notes again because I barely revised the notes in the previous for that previous INA, sir. So for this time, I have gone through a few Bradley tables and Harrison, a few topics, important topics, and again revised your notes. And luckily, Marrow added modules also. So I finished all the modules after reading the topic. I used to attempt the modules. Also, the mock tests which are conducted, the INA mock tests which are conducted. Actually, in INA mock tests also, I used to barely qualify, sir. I used to not get a good marks in the INA mock, but I used to attempt every mock exam and every grant test. So like that. Also, that paper was very tough, sir. This paper was very tough, sir. So again, I thought, okay, I'll not be qualifying for this, but somehow I managed to get a rank in this exam, sir.
Actually, that your story, that is what I was telling. Like your perseveration is actually something is really like among the all the like we are taking the interviews like every after every sessions I used to take one or two three interviews, and among the all the interviews till now I can frankly tell that this will be the most motivating interview that I am going to take because the perseverance you have shown is really wonderful. What happens is like even I have faced the same thing when I was I actually did MBBS from a private college only. So when I passed out, I also had a feeling that we are not in the league, we are somewhere below, and that thing
Yes, sir.
I can sense that sort of feeling. Like that
Yes, sir.
actually what the students has to understand is that once you have passed your MBBS or like MD, to pass such a difficult subject, whether it is MBBS or MD, you need to have minimum quality of brilliance. So if the from that point everyone is same. There is I don't believe personally in brilliance. I believe personally in the like if you spend time and if you work on it, nothing is impossible. Especially cracking exam is not impossible task. That you and you are keeping on fighting even after the exam. You if you got a good rank also you left it and then you want to take in your place, then you wrote next NEET. And when you're telling like I want to prepare myself, that is actually I mean there may be need of guidance, but the 99% of stuff has to be come from whoever is writing the exam. Only 1% is something which we can help and we can guide. Remaining is actually from the way the mentality is very important. Like you were telling, you were keep on writing the exam, and that is really uploadable and really motivating to the students. I'm really
Thank you,
happy
sir.
to taking an interview. Actually, this is we are taking in the middle of the night. Even this time, I'm feeling really happy, uh, and
Thank you so much, sir.
I can understand the pulse of you, because I was also once I after passing MBBS, I also stand in the same line. I also was thinking the same way you were thinking. This is not my cup of
Yes,
tea.
sir.
I was also going the same way. So I can really understand it. And like you were telling that you prepared for the NEET and then you prepared for the INI, and you started watching Marrow in the middle, like after the first two attempt you were trying for Marrow. So
Yes, sir.
so what actually changed you? Like what were the things that were giving you confidence? Like okay, this time again I'm going to write. Like you were like after passing MD, it is not like MBBS. You will reach a time where
Yes,
you
sir.
think that okay, now I'm writing one time, two time, I now I have to stop it and I have to go and work for work that will be better. So what pulled you back and made you to write again and prepare again?
Actually, that if I would not have qualified in that April session, sir, I would not have attempted. Maybe I would have settled for a NEET seat, sir, because getting a rank 25 with minimal preparation, actually, frankly speaking, only 25 days, sir. I actually prepared for 25 days, 15 days. I 1 month, sir. Barely 1 month. I prepared for that April exam, sir. So with minimal preparation, I got a rank of 25. So why not prepare for again 2 months and getting a rank of, maybe I may get a rank 25 this time. But actually, this session I came to know there will be more number of seats compared to the previous session, sir. Uh, in the previous April mid-year session, there are only 21 seats available, sir. So I could barely get a seat, sir. So at this time, they have given 34 seats, sir.
Yeah.
So why not keep double the time, like 1 month for the mid-year session? Maybe 2 months may be sufficient for end of the year session. So and another thing was, if I would have got a good rank in the NEET, I would be not be preparing for the INSS, sir. As I got a rank of 801, I was not satisfied with my rank and also not satisfied with my attempt. So I thought, okay, there was in this NEET. Then I changed my mind, sir. I thought this NEET is not my cup of tea. I have to read INSS only because it includes only neurology. If for NEET, I have to study the entire medicine. Reading entire medicine became tough for me, sir. After preparing for multiple INSS exams, preparing solely for medicine, because they asked some random topics, sir, and also pediatric syndromes. Luckily, in INSS, they will not be asking any pediatric syndromes or anything. Only 60 questions they gave. They asked actually out of 80, they asked 60 out of neurology, sir, 20 from medicine. So I thought, okay, I will go through statistics, I will go through neurology part, and only 20 marks. Reading for 20 marks for medicine is easy, sir, compared to reading 150 marks for medicine.
Yeah.
So then I changed my mind, sir. Okay, I will not be reading NEET. If I don't get any rank in this attempt, I've also made a plan to crack next attempt also, sir. Next INSS was in April 1st, sir. So I also made a plan for next attempt also, sir. If I don't get a rank in this session, okay, I will be attempting the April 1st session. I will be extending the Marrow plan. I'll be again watching sir's videos. I would have missed something in that. I would be reading
Yes.
Bradley tables again. I'll be reading Adams also this time. So like that, I continued my preparation, sir. Luckily, it gave me an
That
opportunity to stop my
mentality is
preparation now.
that mentality is something which is actually required for those who really desperate to like want to crack an exam. That is something, that mentality is something what is needed. And
Yes,
you
sir.
told that you watched the entire videos. Like actually, in fact, in the entire Marrow super specialty, I think neurology session is the most lengthiest videos comes. So how much
Yes, sir.
time did you have to spend to watch the entire videos? Roughly around how much days? How many days you were able to finish it?
Roughly 25 days, sir. Each day I used to watch 5 videos, sir. There are totally 120, around 130 to 120 to 130 videos, sir. So I made a plan for watching the videos also, sir. Daily I used to complete 5 to 6 videos daily. Three 1 hour videos and two 30 minutes videos. Like that, I used to watch 5 videos per day. So I completed the entire videos in 25 days, sir. After writing the notes, I prepared again. I revised again for 10 days, sir, like that.
Yeah.
And now the major point for this preparation was I already had the notes, sir. So actually, I can prepare from Bradley. I thought, okay, I'm having the Marrow notes now. So the major power was with me. So I'll be adding some points from Harrison or Bradley. Mostly you covered from Bradley, Adams, and also used to find some points from journals also, sir. There are not what some points what you have mentioned in the class. I could not find some points in Bradley and Adams also, sir. I used
Yeah,
to see the points in some journals also. So okay, I thought okay, I'm I'm updated. I got updated now. I will not be missing any point now, so I can go confidently for the exam.
actually, I have prepared actually from Bradley plus journals plus actually Adams not that much, but predominantly from Bradley and journals and many of the updates and
Yes, sir.
some of the CME things and all the stuff I had included with something which I studied. How I studied for my exam, I was doing the same thing, and in fact, the problem about neurology is actually the subject is very vast. That is why the
Yes,
videos
sir.
also become so much lengthy because without knowing the details, it's very difficult to crack because patterns are keep on changing every time. Patterns are keep on changing. Even this time patterns they went and asked many very basic stuff of exam questions were there. So you
Yes,
need to
sir.
have a good knowledge about the neurophysiology, neuroanatomy, and at least some basic fundas you need to know. Then only you can approach the disease. Because if you go like that, you
Yes, sir.
can go for any pattern. Like whatever pattern comes, you can go like that. Go and prepare for that. So and how was your preparation for phase two, and how was your phase two exam as well? What we were discussing the same way you are telling. You can tell how was your exam and phase two because you are one among the few who had done extremely well in phase two and you got a very good push from in phase two. So how was how was the things went in phase two? And how did you prepare? Did you do any
Uh,
preparation for that specifically?
Phase two, sir. Frankly, I did not prepare well for phase two, sir, because actually in the previous interview, which was I attended in April, they asked me one question, sir. They kept an MRI and they asked me four questions regarding that MRI, sir. They told me to identify the MRI, and I told instead of T2, I told it as T1 contrast, and I was done mistakes in that. So I thought, okay, let's skip this interview. Why to attend? Oh, there is no need, I thought. But okay, maybe this interview might help me getting a rank. So I attended the interview, sir. But one day, actually, you conducted a mock interview, sir. So I attended the interview. So then I came to know that, okay, you also told the point that approaches are very important and they will be asking approaches and
Yeah.
not many points, sir, because in that there may be allotting hardly 10 minutes time for a candidate, sir, 10 to 20 minutes hardly for a candidate. So in that 10 to 20 minutes, they might not ask every gene or any mutation. So they'll obviously asking how will you approach the case. So I got that point, sir. Okay. So 2 days before 2 to 3 days before the interview, I prepared for the approaches, sir. I opened your notes and I saw where are that all the approaches. So you told approach to peripheral neuropathy, approach to myopathy, approach to stroke. What will you do after the stroke? What will you do if a stroke was presented after window period? Actually, that approach to neuropathy helped me, sir, because they asked me three questions in the interview, sir. First question was regarding a 40-year-old male patient who was seen unconscious on road, was brought to your casualty. How will you approach the case as a neurologist? So I was telling them only the neurology part, sir. I'll see the pupils, I'll check the planters, I'll check the tone, I'll check the GCS. That is not they are expecting, sir. They are expecting vitals from me, sir. They ask me initially we'll check the vitals, we'll check the GRBS. Later we'll be conducting the neurological examination. So after that question, I came to know, sir. Okay, they're asking general approaches, not neurological part. So second question was like Wilson's disease, sir. KF ring, they have kept me and asked what are the causes for that and what are the presentation of this condition. What is the
Okay.
treatment? Because that question was regarding Wilson's disease also asked in INSS exam, sir. So I thought, okay, they are asking the same questions maybe in the interview also. I felt in that way. And third question is they have kept a history, sir, like a male patient suffering from burning hands and feet from 3 months. How will you localize the peripheral neuropathy? What questions will you ask to localize the patient's condition? So they are expecting what will you ask for peripheral neuropathy, for radiculopathy, for myelopathy. That's only approaches, sir. They do not ask any theory questions, sir. Only approaches, sir. How will you approach an unconscious patient? How will you approach a peripheral neuropathy case or myopathy case, myelopathy case, like that, sir.
Actually, I was telling you in preparation of the same thing. Like when you're going to sit in front of a neurologist and you are going for an national institute, they want to know whether you know how to approach the basic stuff. And the best way to get the knowledge, whether you have cracked the exam by knowing the facts or whether you actually know the stuff, is best way is always approach. And I can tell you that any neurologist sitting for a viva or exam, they are not going to ask you any genes, any values, and all, because we all know that they are actually useless. In fact, for exam it is
Yes, sir.
useful. Otherwise, anytime you can search the net and you can get it. What is important is
Yes,
something
sir.
is you cannot search from net is to approach a patient, to arrive at a diagnosis, how to assert things properly. These things you cannot learn with the Google or anything. That's something which you can build up only with your knowledge and whatever you're studying. So that is
Yes, sir.
actually you might have done, even though you have missed certain things. It is obviously like in any interview when you're going to sit. Obviously, you cannot answer everything because the person sitting against you is someone who knows everything, at least most of things. So you cannot answer
Yes,
everything.
sir.
But if you are in the right path or not, that is what they are going to see, like whether you are in the right path or not. And you as actually you might have impressed them very well with your answers. That is because your approaches might have been very strong. And I want to ask why, how and why you like neurology, and why when it happened, whether during your PG time or after that, or during the MBBS time only you were liking neurology, you want to become a neurologist. So how was it?
Uh, During MBBS, I thought, okay, I was fond of medicine, sir, general medicine, because frankly speaking, not about the subject, sir. Students used to give more respect to medicine PGs, sir, than other department PGs. So that actually was in my mind, sir. Okay, I will also take medicine, and I will also gain some respect among students. And it also, the rounds were very interesting, sir, compared to surgery, which was full of dressing the wounds or any suture removal. So, okay, I thought medicine was very interesting. At that time, I don't have any idea about neurology or cardiology or nephrology, sir, because, okay, it was just medicine. These are all sub branches. Okay, there is, I don't know that after MD, you have to do DM also. I don't have that knowledge, sir. During my MD, during first year, I hated neurology the most, sir. My first hatred was during towards neurology, sir, because I could not understand any neuropathy case. I could not localize a stroke. I could not identify myopathy also. Why myopathy is proximal? Why neuropathy is distal? I could not identify, sir. My neurologist used to do a reflex and plantar, and he used to localize, okay, this is simple neuropathy case, this is not myopathy case. So I could not understand any ABCDs of neurology also, sir. So in first year of MD, frankly speaking, I hated the neurology the most, sir. At that time, I liked endocrinology the most, sir. Okay, it's a cool branch and also it's interesting. We can evaluate a patient, can take a history. During my second year, we used to have peripheral postings, sir, to neurology and other super specialty departments. At that time, I went to neurology department for 1 month posting, sir. During that period, there was a professor in our Guntur Medical College, sir, Sundarachari, sir, Dr. Sundarachari, sir. Actually, he taught neurology very well, sir. He used to stand for 1 hour beside at the bedside, and he used to diagnose NPH cases also, sir, with the history. He used to diagnose any myopathies or rare cases like Rasmussen syndrome. He used to diagnose those in his rounds only, and he used to send the MRI and CSF findings, and they used to come positively, sir. So I thought, okay, not endocrinology. Urology is having more of history part and examination part. So I myself got involved in the department, sir. And I used to take CSF. I used to read MRI. I used to learn how to read MCS. And so finally, I came to a conclusion by third year, sir. By my third year of PG, I came to a conclusion that okay, neurology suits me very well. I like more of approach, sir. Approach to a case. So I like to approach a case in a systematic manner by taking history, by clinical examination, and correlating that with investigation, sir. So that I observed all departments, and I came to know that okay, neurology will suit my approach of a patient. So at that time, I opted for neurology. But like bad luck, could not. I did not came to know that there was an app for preparing for the super-speciality exam. So during my third year, I used to read some manuals, De Jong's manual or
Yeah.
some Bradley tables for that, but I did not have any access to apps, sir, because I don't know that there is an app for, because the only less number of students used to use in my college, sir. Later, after passing out from the PG, I came to know that everyone in India is using the Marrow app. So why don't I give it a try? So I subscribed for Marrow after
And
getting
how did you
a
feel the
not a good
difference?
rank in it.
How did you felt the difference? Like when you were reading, you were reading Bradley, you were reading Rinji Chong at least partly, and so when you read the same stuff after listening to the classes, or not mine, anyone's, like you had gone through somebody teaching you, and how did change your approach to a textbook?
Uh, Actually, after listening to classes, I came to know how to read a textbook, sir. How to read that textbook, because initially in third year also I read few topics, sir. Like for example, multiple sclerosis, sir. Our college, our hospital neurology department used to admit more multiple sclerosis cases, sir. Multiple sclerosis or neuromyelitis optica cases they used to admit. At that time also, I read multiple sclerosis in Bradley, sir. But at that time, I thought that okay, I understood everything about multiple sclerosis. I understood everything about neuromyelitis optica. After listening to classes, okay, I thought okay, I'm in a wrong perception. This is not this is not what I read about multiple sclerosis. After listening to class, after reading to your notes, again I went back to Bradley and I read it again, sir. So this was completely different, sir, because explaining something is important and self-explaining ourselves is something important, sir. Because if we read for ourselves, it will be like if we don't understand, we'll bluff ourselves with that fake concept, sir. Like, okay, this is only MS. If a patient get optic neuritis only, it is MS. If a patient get this finding only, it is MS. Later, there are many presentations of MS. There are many even uh, in my third year PG, I thought that okay, sensory complaints is not a part of MS, seizure is not a part of MS. But after listening to the classes and after reading Bradley, I thought okay, even 1% of patient may get sensory symptoms, may have seizures also, like that. So my understanding of few topics, many of topics changed after listening to the classes there. So I
See,
can now understand neurology in a better way.
See, I used to get some queries from students that some people think that you have to read Bradley out and out. See, frankly, I can tell you that even after passing out neurology and 2 years after passing out, I had not read Bradley line to line. I had lot of pages, a lot of chapters, lot of areas I had not read in Bradley. So the thing is that Bradley neurology per se, each is a speciality. Epilepsy is a specialty, neurology is a specialty, or this movement disorder is a specialty. So each specialty is a separate subject. So that happens in neurology. Neurology has become so much specialized, unlike cardiology, unlike other subjects. So what happens is Bradley is a concise thing about each specialty. It won't give everything in Bradley. And Bradley or any textbook per se, if you go and read, it is very difficult to understand first time. If you have reading again and again, you read from different areas, you assimilate the concepts, then you go and read. It will be easy to read. Then you will understand that okay, these things are already which I read in that journal. It is there in this Bradley, but it is given there. I didn't understand it. So that thing happens even if when you're reading Harrison also. So that way, even you are going to when you are going and joining a neurology, if you are sticking to one textbook and trying to read, and somebody is telling that if you read out and out, you can do super. I don't believe in that because nobody can read and remember everything. See, the best thing is to have the concepts, then go and refer things and learn things. So that is what I think might will help you. That is my idea. I don't know whether it is true or not, or will help or not. That is what I think personally is. And you are one person who's watched some Marrow videos, like my videos, almost all videos you had watched. So what all videos you liked, and any suggestions you want, like to add something or remove something, and this thing is where you can also tell. Like that will help the
Uh,
coming.
Okay, sir. Actually, adding no, sir. It's actually complete, sir. The modules are complete. Videos are very complete, and actually, I could find more extra topics in that video, sir. Like leukodystrophies was not at all. One point was also not mentioned in the Harrison, sir. Barely they mentioned about adrenoleukodystrophy or other diseases, but actually I could get even extra points, sir, from the modules also. And the the part which helped me most was the stroke part, sir. Stroke localization, because I read in Harrison, sir, but I could by heart if you saw anatomy part, sir, because I could not understand in Harrison. So okay, I thought localization of stroke, because in my during my PG period also, localization of stroke was the difficult part, sir, because everyone will be having hemiplegia only. Everyone will be having either paraplegia or quadriplegia. Everyone will be having some sort of sensory symptoms. So they used to ask, my consultant used to ask me whether it is thalamus is involved or midbrain is involved, and what is the syndrome if midbrain and thalamus is involved. Localize the artery. He used to ask me localize the artery also. I can't even localize the parenchyma structure also. How can I identify artery? So I listened to that video, sir, because that was the major question after completing my MD period also, sir. How to localize a stroke. So in your all videos, the part which helped the most was the stroke anatomy, sir. Stroke anatomy and stroke localization, along with stroke treatment, sir. Because as a MD resident, I just used to see the stroke case and refer it to immediately to the neurologist, sir. We don't intervene in that case. We don't have any interventional role in that case, sir, because patient is in window period. If we don't send to neurology department, patient will die or patient may have more major focal neurological deficit. So we don't have much of the interventional part, sir. We don't know what will happen to the patient if a patient goes to the stroke unit. So after listening to the videos and all, it helped me, sir. Okay, like this case will come within 4.5 hours. We have to do this. We have to give either tenecteplase is available. We have to give bolus. Or you said that in a case of mechanical thrombectomy, tenecteplase is helpful actually. Altiplase should be given 10% as a bolus and 90% as infusion. So all that practical part, it was very good, sir. After listening to your classes, I again went back to Harrison, sir. And at the time, I understood every point of the Harrison, sir. So the stroke part was very awesome, sir. It helped me a lot in approaching the cases. And also in neurology, also in maybe I'll be joining in a few months. So this approach will help me because stroke is the common case for even MD also, sir.
In fact, if you're practicing, like I'm practicing as a neurologist since last 2 years only. So since last 2 years, 90% of cases coming to the casualty, maybe 95% will be stroke only. Stroke is a bread and butter. Whether you practice in as an epileptologist, whether you practice or whatever, because you're practicing as an epileptologist, also you take duties. So stroke is something is for MD physician as well as for medicine. I mean, neurology, and to know neurology, to understand neurology, the stroke is a basic case. So it deals
Yes,
with the entire human system. You have to do with everything, vascularity, everything you need to know. And I have to tell you that you have to call your neurology professor, sir, and inform him that you have cracked neurology and you are going to join a national institute. You have to
yes,
inform
sir.
him. He will be very happy
Yes, sir.
because
Surely, sir.
surely he will be your mentor. There is actually everyone needs somebody like that to stimulate you, somebody who
Yes, sir.
guide you. I mean, not directly, indirectly, somebody who influence you to pave a way towards some subject which become your core later. And actually, really, I enjoyed talking with you. Really, I was spontaneous into it, and really wonderful job. And
Thank you,
actually,
sir.
it should be motivation to many. Like what happens is like there are like after this new pattern come up, it is really have an advantage to those who are passing out. Just fresh pass outs is always the advantage, and
Yes,
those
sir.
who are finished 1 or 2 years, they feel in their mind that now it is very difficult task because young generation are behind them. They know the subject better, and you prove that that is wrong. Anyone can crack if you spend time, perseveration, and that is something which you need. And
Yes, sir.
really wonderful. Congrats.
Thank you, sir.
And
Actually, thank you so
no,
much, sir. As I said previously, my INA preparation started with your videos, and it took me forward and it gave me motivation, sir. Because with the video, actually, I built a skeleton of neurology, sir, and in that I filled some tables from Bradley, or which you said is important, or some points from Harrison. So the basic framework for my preparation was your notes, sir. Actually, I used to. I actually wanted to message you, sir, after the exam, but I was not confident about the results, sir, because after messaging you that I have done very nice, and if I don't qualify in the exam, that will be I thought that it will be a shame for me. So after getting the rank, okay, I will contact the sir, but I got a chance to talk to you now only on the same day of getting the rank. It was my pleasure, sir, actually talking to you. Actually, thank you heartfully, sir, because your videos helped me a lot, sir, because I know the value of my notes, sir, because I used to carry my notes in my senior residency, sir. Even that classmate to 400 pages notes I used to carry, sir. That book was almost like 10 years old notes, sir. It looks like a 10-year-old note, sir, because it was torn. It was because I used to carry every day with me, sir, in my bag. So like that, I used to read some points, some genes, because you told me, sir, you, regarding genes and some mutations part, you told us to read or at least see day by day or have a weekly revision of those so that we can remember not the day before exam. At least read them twice or read them once a week. You told that in the class, sir. So I used
Yeah.
to go through the mutations, go to the channelopathies topic, sir. Channelopathy, sir. One more, I forgot to mention stroke part and channelopathies part, sir. Channelopathies part is very much helpful, sir, because when I saw Harrison for the first time, I could not find all the genes, sir, because somewhere it was mentioned about hypokalemic periodic paralysis, somewhere it was mentioned about familial hemiplegic migraine, somewhere it was mentioned about episodic ataxias or any nocturnal epilepsies. But you consolidated all that matter and added in that notes, sir, in that video, sir, channelopathies. That also helped for revision, sir, because finding ourselves the mutations were very much difficult, sir. You compiled that and you covered everything, sir, in that. So the channelopathies topic and stroke topic was awesome, sir. It helped me a lot in easing my preparation. And also, as I said previously, you indirectly guided me for my preparation, and also directly you guided very much, sir. So I heartfully thank you
I am
for
actually
helping me achieve this
very
position, sir.
seriously very happy, and even if I helped you for 1% of your success, I'm really happy. And I still tell you that whatever I or any other person help is only just 1% or just more than that. Remaining everything is your effort. It is something is you have got it by your effort. Really, really awesome. And
Thank you, sir.
thank you so much, and nice to talk with you.
Thank you so much, sir.